Good afternoon, hello and namaskar. I am Sanjeev Pandya welcoming you to the Ayurveda Mantra Show. In this weekly show, we talk about importance of Ayurveda and the Panchkarma with Dr. Ambika Nair of Santigram, Kerala Ayurveda Wellness Centers, USA. How Ayurveda can cure and can really treat any disease that any individual can have, and Ayurveda can be very effective. It has no side effects, and it can be done through Panchkarma, it can be done through Ayurveda medicines and whatnot. To talk more on Ayurveda and today's topic, first I'd like to welcome Dr. Ambika Nair. Ambika ji, namaskar, welcome to the show.
Namaskar Sanjay. How are you?
I am okay, thank you very much.
Hope you all are doing very well.
You know, I must say to you, doctor, and then the viewers, that you're always full of energy, you're always smiling. That means she's the one who not only teaches on Ayurveda, but she practices Ayurveda every day.
I don't preach only. I really take only Ayurvedic medicines.
Okay, so it really helps when you follow Ayurveda, and for years and years, it really helps, and that is evident in Dr. Ambika Nair's personality and the way she talks. Anyway, in this episode, Dr. Nair, I think we should talk about something really important.
Yes.
About 1.6 million Americans are affected by this, and I'm only talking about Americans in America.
Yeah, absolutely.
Worldwide, there may be many millions out there, and it's called rheumatoid arthritis.
Oh, wow. Okay.
Okay. In short, it's called RA. Now, first of all, Doc, I want to ask you a question in brief.
Okay.
What is difference between arthritis and rheumatoid arthritis?
Yeah, arthritis just natural because their rheumatoid factor will not be. See, when you do the blood work, so that RA factor will be negative. Okay. So that is arthritis. Sometimes, their blood work like ESR level, erythrocytic sedimentation rate, this all will be because of the inflammation it will go. But rheumatoid means it will be always positive, RA factor. Not only that, it is an autoimmune disease. Why it is called autoimmune disease? Because your immunity goes down very, very badly.
Okay.
Yeah.
Is it true that maybe you get arthritis and then you get rheumatoid arthritis, or sometimes you don't get arthritis and you directly get rheumatoid arthritis?
We are getting RA patients, like rheumatoid arthritis a lot these days because they were on all medications, so many medications. Everybody knows that what I am talking, and so many people are treated, and they are doing very well with the Ayurvedic medicines and Ayurvedic therapies, what we did. Actually, RA means rheumatoid arthritis called Ama Vatam. Ama is turtle. All your joints become very stiff.
Achha.
You cannot move because first of all, it is always like that. And it always starts, so it is not a must that it should start only on the knee or anywhere. What we see is that they complain, they become so tired. Little low grade fever will be there, they cannot move, they are always, very lethargic. Yeah.
Even if they move, it's very, very slow pace, like turtle like.
No, they complain, how they will know they are having, like a RA factor, because they were very active before. So this is the, what they feel first of all. So they were not active, their, sleep is little disturbed, whole body pain is there. They don't feel like eating, and all the joints they feel, Mostly this is seen in, when they are very young in the teens.
And what causes rheumatoid arthritis?
If you see like a chronic allergic sinusitis, okay, see little weather change, okay, they get the dust allergies, all those things, because they always feel that heaviness over there, always on antibiotics. Like the moment they finish the antibiotics, it will be there again. So like that immunity goes down very well. That's why it is an autoimmune disease.
Well, nowadays maybe perhaps 1 in every 3 individual taking antibiotics.
Yeah.
You know, everybody is on
Yes.
some kind of medication. So what you're trying to say is that whoever is on the antibiotics, and if it's a heavy dose of antibiotics, most likely they will get rheumatoid arthritis.
No, it's not an answer like that.
Okay.
Actually, if you take antibiotics and all, if you have the doctor takes care of your liver, okay, then it will be fine. But you know, like anything, you know, whether it is Ayurveda, allopathy or homeopathy, if you take in excess, what is not needed, naturally it will be a poison to the body.
Okay.
Yeah, that is the way it is. Yeah.
For rheumatoid arthritis, does age matter? Do people get it in a young age,
Very
mid-age?
young age.
Acha.
I've seen like even children with 3.5-year-old.
Really?
It was a RA factor. That was in my one of my other centers. In here I am talking. That was the very young child, you know. And another one was like a very little more younger. Child cannot even, because all swelling, everything, you know, then they told that it was RA factor was positive.
Okay.
That was even just 1 year. They cannot even express. Very, very sad to see the cases like that.
Okay. If someone comes to you, how do you diagnose it and what steps you take to cure that?
See, Sanjeev, always, you know, people come, they go to so many places, so many doctors, then only these people
Yes,
come to us.
exactly.
Okay.
Ayurveda always
So,
comes last.
yeah, so that's, you know, like they will think, oh, okay, ये तो देशी पता नहीं क्या करेगा. This is always that.
But in the end, they said that was the
No,
best.
they will come. I have like now also have so many people are there with me. So you know, like when they come itself, see this, see how it affects is that it always affects the synovial membrane of the, you know, like our joints. Okay, then the tenderness will be there, swelling will be there, and you cannot move it like that only. You know, like that stiffness will be there. You won't be able to move forward.
Correct, correct.
That's the thing. You know, they always feel fatigue. So tired they cannot even do any activities. Then with that they will feel so much of anorexia. They don't feel like eating anything. They feel as if something is kept on the chest. You know, that is one of the things. You know, yeah. So when somebody comes, you know, we always see that how they are. I see the pulse. I ask them, you know, like what all they have. Actually, Nadi analysis is. It is like a vision, I should say.
Correct.
So then I will ask them what all they feel it, because that is also more important. What we observe through the pulse and what we observe also, then which all the joints, sometimes the small finger joints are also so much inflamed, and some people come with so many deformities. Okay, they cannot even open.
Wow.
That's because they cannot function any normal, you know, like a routine life. That is also there.
I see. Anyway, hold on to that thought. We're going to take a break, and when we come back after the break, we'll continue to talk on this rheumatoid arthritis in this Ayurveda Mantra show. Welcome back to the Ayurveda Mantra show. In this week's episode, we're talking about rheumatoid arthritis known as RA with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center, USA. As you know that Dr. Ambika Nair, having 30 plus years of experience in treating individuals through Ayurveda herbs and the Panch Karma treatments. And we just started to talk about rheumatoid arthritis, and when a person walks into Santigram Kerala Ayurveda Wellness Center, USA, any of the locations in the USA, right, doctors say the first thing they do is that they check on a pulse. And after the pulse, you know, what are the steps of diagnosis? How do you diagnose and what do you come up with?
Okay, because when it is a rheumatoid arthritis, we see that whether any deformity is there, you know, whether they are able to walk properly, you know, like all these small joints will be so much swollen so that they won't be able to move it.
Does it become like numb? Let's say
not only numbness, because they cannot move it actually.
Achha.
That destruction will be there actually.
Wow.
You know, like a cartilage become like a fibrous tissue, and it will become like a heavy, you know, like it will not move. No, movements are not there then. This is called fascia formations.
Correct.
Okay, then they cannot move it actually.
Okay. If they go to a regular doctor for antibiotic treatment, they have a medicine for that also.
They have so many like cortisones are there. There are so many things, you know, they treat like how they treat cancer patients. And all they come with, because I don't want to talk anything about them, you know, like that. And we see that, you know, so many nodule formation will be there. Because of the, you know, lymphatic system, there is no movement. Circulation will be totally impaired, you understand. So we see that how they are, which all the places, because it is all the, everywhere it will be affected.
Correct.
And not only that, it can, if it is not taken care, means they always, that a fibrous tissue formation will be there in the lungs also, and it can even come to the pericardium, the covering up the heart also.
Does any gender matters? Maybe South Asians don't get that much rheumatoid arthritis. And
Oh
other-
no,
No.
the stress level is also another factor. It's too much in this place,
Stress is everywhere, and stress is part of almost every single
But
disease
the people
out there.
don't take it in that light way, no. They
No,
think
because-
that, yeah.
Because we live in a very competitive world, and
They-
everyone wants
yeah.
to prove themselves to be something. But point that I'm trying to make is that once you go to Santigram Kerala Ayurveda Wellness Centers, USA, right, and you have that Panchkarma treatment
Yes,
done,
yes.
Panchkarma treatment with the right herbs and the right oil, it can certainly make a difference.
Treat for the cause.
Yes, exactly. Now coming back to this rheumatoid arthritis, is it more in female than male?
Females only I have seen the most actually, but I have seen in males also a lot. Okay, but comparatively I have seen females more.
Okay.
Yes.
Any side effects? Any long-term effects? Let's say
Oh, it's
someone
only
just
side
someone
effects.
someone just lives on antibiotics, right? And
No,
then-
they don't give antibiotics. There are so many other medications. I don't want to discuss because I am.
Okay.
We are talking about.
So what I'm
Ayurveda.
saying, long-term
Yeah.
effects में कुछ
Yeah.
होता है ऐसा?
नहीं हो जाता है because side effects इतना ज़्यादा है because they cannot, they will tell that this finger doesn't move, this will not move, I cannot walk with this, I cannot go like this. Their back will be, a lower back will be affected.
Correct.
Because it can affect the spine.
Yes.
So it can affect even the, the upper part of our body, like a spondylosis. So where all degeneration and fibrosis will be there, like a fascia formation. Then they won't be able to, their movements and all everything. And daily life, they won't be able to do it. Very difficult.
Can you share an experience, Dr. Ambika Nair, that someone came with a severe rheumatoid arthritis and how right treatment at Santigram Kerala Ayurveda Wellness Center was helpful for that person to cure rheumatoid
Yes,
arthritis?
I know actually one guy, there are so many cases like that.
Correct.
On that day, his doctor told him that he cannot take any more painkiller. Your liver is already on the brim because no more painkiller. He was very depressed and he
And
knew
how
that
long he was on that painkiller?
Yeah, he was on allopathic medications.
For
so
years.
many, I don't want to tell the names and all. Okay, very, very heavy medications was given to this guy. And he is working as a very, very senior post. So he cannot afford to lose the job.
Correct.
So he came. We did 28 days of treatment.
Acha.
Yeah, because it was already affected on his lungs
28
also.
days straight.
Treatment, yeah, straight, because there was no other way. He could not even move. He was in a very bad shape, actually, I should say. He stopped, he could not take because his doctor was very nice. He only told that not to take because then you will not be able to perform anything. So he was only 43-year-old.
That young, huh?
Yeah, very young. After, when he became better, his mom came and saw me. There are so many cases like that. This is not only one, it was, and we always do the assessments, that daily I was seeing him also.
Correct.
And we have very good people also to do all the therapies,
He is cured and obviously rheumatoid
Not
arthritis
completely cured
treated.
because his RA factor was gone and his movements were better. Okay, and he could articulate much better and he was performing everything normal.
Okay.
So, once they become normal means, whom all he knows, they will send all the clients to us only.
There you go.
Yeah.
Before we go on a break, my question to you is that would he have to come for the same Panchkarma treatment every year, 6 months?
No. After 1 month, because
Yes.
that was very much needed at that time.
Correct.
Because he was getting into deformities. Okay, then afterwards, that after 1 year, we did his 2 weeks of treatment. He told that I am doing much better, he told. So he takes very little medication, little in the morning, little, so that, he will not be, bedridden. You understand? No?
Okay.
Yeah, that was very nice actually.
Okay.
Yeah.
Well, thank you so much, Dr. Nair, for that information. Viewers, we're going to take a break, and when we come back, we'll continue to talk about rheumatoid arthritis in this Ayurveda Mantra show. Welcome back to the Ayurveda Mantra Show. Before the break, we were talking about rheumatoid arthritis in this episode. In case if you just missed it, just want to let you know that rheumatoid arthritis is one of those growing diseases in America. About 1.6 million Americans, all kind of Americans, are affected by this rheumatoid arthritis. They go to doctor puts them on painkiller, antibiotics, and you could be taking it for days and months without seeing any result. What we are trying to say is that Ayurveda Panchakarma treatment with right amount of herbs and the oil mixed into it, which Santigram Kerala Ayurveda Wellness Center is known for that. They are the authentic Kerala Ayurveda Wellness Centers in the USA. They can cure any disease, and how rheumatoid arthritis can be cured. We heard from Dr. Ambika Nair that how they cured a person with severe rheumatoid arthritis. To continue the conversation with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers, USA. Doctor, once you diagnose that and once the treatment begins and everything, what about food habits and diet? Is it also become part of that?
Yeah, first of all, their digestion will not be right. They always, they will have a constipation. We see the tank diagnosis also, no?
Achha.
Yeah, so
Okay.
we see when we do that pulse analysis, we analyze them properly, observation and analyzing very properly. And we'll ask the client also how they are, everything. Yeah, this is like a Sarasaya, like how our Bhishmacharya was lying. They cannot lie on the bed.
Achha.
Very bad it is, because in a different positions they will be, because movements, everything is restricted. So, a constipation will be there, especially when they have it in the lower back, severe constipation.
And you also mentioned earlier that sometimes patients don't feel like to eat anything.
Yeah, because actually once it affects the lungs means, because they always feel heavy. Their digestion is so poor, so they don't feel. So this is, their metabolism is very poor. We call it as Agni, that it is like a very low weight. So whatever you eat, it doesn't digest properly. That is one of the things. But still, see, our people around will tell, you are not, तुम तो खाते नहीं है तभी तो तुम बीमार हो रहे. So जबरदस्ती उनको खिलाएगा. You understand, no?
सही बात है.
See, so you should not eat, like that.
So what should you eat? What is the diet plan?
The diet is very important. We only give cooked food and very light food we give.
Okay.
Yeah, they can take ghee, but not very oily food. Sometimes how it comes also, it is very interesting. We have a very bad constipation. We don't bother for ourselves. You understand? Also, theek ho jayega. Like a cough, chronic cough for a long time. Then immunity is coming down.
Correct.
And you are not bothered. Your whole body pains. They will buy, especially in Delhi, I have seen that how they take so much of Brufen. They eat it. 4 Brufen खाकर हम सुबह नौकरी के लिए जाता है जी.
अच्छा?
Yeah, they talk like this to me. चलिए आप जाकर अभी किधर पहुंच गए आप? It's very difficult.
It has become normal in their
They are
life.
very comfortable with taking medicine. Otherwise, कोई डॉक्टर के पास जाएगा तो they will give cortisons. They take so many cortison injections everywhere, then they come. उसके बाद तो जब बिल्कुल नहीं चला जाता है, बिल्कुल हाथ नहीं चलता है, पैर नहीं चलता है, like amam. Okay, so then they become like that. Ama means itself, you acquire all the toxins in the body.
Correct.
Then only, it will become a disease. It doesn't establish just like that. It takes time. Yeah. And not only that, you will get all the crepes, when you get all those things, like a cut, awaj, like a jodo mein.
Correct.
So these all, they should check it, what they are, And about the food, like only cooked food, no raw food, no salads. Because this will be like some people will be kapha oriented, and some will be with vata oriented, some will be with pitta oriented.
Correct.
So we will give them only cooked food, and cold food is never advised for anybody.
Okay.
Yeah.
In the end, doctor, what are the early symptoms of rheumatoid arthritis?
Yeah, they will always, like stiffness in the neck part. Okay, like fingers become like swollen.
Oh.
Okay, when they get up in the morning.
Okay.
And they cannot open it till like 11 o'clock like that.
Oh.
Okay, so they will tell that why I cannot fold my hands. Okay, so these things are little bit lethargic, so tired, even though, they were functional before, and now they are not that functional.
Correct.
and they get depressed because they want to do the things. When they cannot do the things
Absolutely.
naturally, it is a depression.
Absolutely.
Okay, they get upset very fast. Or gussa ana. Yeah, this all. Or jaldi bimar hona.
अच्छा,
Because their immunity is going out.
correct.
This all. पेट साफ नहीं होना.
हाँ.
और खाने के लिए तो कोई रुचि नहीं है because they don't have any taste for that. You can see the tongue. It will be like either like a grayish colored or like very thickly coated. So that is their acidity.
अच्छा.
And they say पूरा शरीर पे ना पूरा गुच्छा जैसे पूरा all the nodules will be there.
Wow.
In some cases it is very like all the irregularity. These all things like as they like stiffness in the joints means they should see the doctor actually.
Absolutely.
See, not only like a Panchakarma or any Ayurvedic doctor is just like that advising Panchakarma. If no Panchakarma is also needed, doctor can advise you for a corrective diet. That is more important
that is the
actually.
most important
That is
thing.
more important.
Okay.
More important.
But obviously, Ayurveda Panchakarma treatment really helps.
Yes.
Dr. Nair, thank you so much for letting our viewers know about this rheumatoid arthritis. And viewers, in case if you have or if you know someone's got this early symptoms of rheumatoid arthritis known as RA, then please have it cured soon as possible. And this is the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Centers USA. And every week we talk about a disease and how Ayurveda Panchakarma treatment can cure that disease. Dr. Mika Nair, many thanks for your time and for your guidance.
Yeah, just one tip, if anything like that, you can always take turmeric, like a half teaspoon in the morning with a little bit of lukewarm water, 1 teaspoon of castor oil every day at night. So this will keep you going for a long time.
Okay. Great.
To get sick is very easy. To come out, it's very difficult. So prevention is better than cure. Keep in mind.
Very well said. Thank you so much for that Ayurveda tip known as Ayurveda Mantra. Viewers, if you have any question about any disease and want to know the cure or treatment, you can send us an email info@santigramusa.com. That's info@santigramusa.com. Until we meet again, make sure to take care of yourselves, stay happy, stay healthy, and thank you so much for watching the Ayurveda Mantra Show. So long and take care.